We do need health care reform in the United States, and I believe we need to move towards market solutions, not towards more and more government control. When government controls things, we don't get higher quality, we don't get lower costs, we don't get better prices. There's always going to be the hard cases, there's always going to be exceptions that we may need to provide some type of safety net for. We have government programs now, Medicaid and Medicare. We're spending more and more money on those programs. Medicaid is in the process of bankrupting our states, and Medicare is actuarially going to take the United States into bankruptcy with the unfunded liabilities that currently exist. We need less of that, not more of it. I just don't think health care is fundamentally different than any other goods or services that we have, from food to shelter to cars to iPods to bicycles. The market provides all of those goods and services better than governments do. You ought to be able to buy the insurance that you want. And the market will provide that insurance if we'll take all the regulations off of it and let it meet the needs and desires of its customers. Right now, health insurance is regulated by the states. They're not allowed to compete across state lines. And so special interest lobbyists add more and more benefits that have to be covered. And that raises the cost of health insurance for people, making the premiums higher and more expensive. It doesn't allow people to get the exact health insurance that will best suit their own personal needs. Imagine if regulations required you to buy certain kinds of food when you came into the store. You must buy that food. You don't want it. Maybe you're a vegetarian. But the government decided you need to purchase a certain percentage of meat, whether you want it or not. So that's analogous, I think. It's the only part of business that I know that doesn't compete across state lines. Competition is what we need. We need competition in order to drive down prices. Doctors have to spend thousands and thousands of dollars on protect themselves from medical liability insurance, and they also practice oftentimes defensive medicine to prevent litigation from occurring. We need to reform tort laws in order to free up the doctors to practice in a responsible way without having lawyers looking over their shoulders at every step along the way. 50 years ago, our country spent 16% of our disposable income on food. Today, we spend only about 8%. So the cost of food has gone down steadily for the last 50 years, while the cost of health care in the last 50 years has gone from 4% of GDP to 17% of GDP. So food's getting cheaper due to the market system. Health care is getting more expensive. Profits are what create change and prosperity. The profits get reinvested to make innovations, to improve health care. Without those profits, the innovations are not going to occur. Let's take Canada, for example. MD Anderson, which is a cancer research organization in Houston, Texas, spends more money on research than the entire country of Canada does on research. The current system is not a market-based system. The government controls it and regulates it and does not allow markets to work, and that's what's wrong with it, and that's what needs to be reformed. I believe socialism was tried in the 20th century, and it failed miserably.